Stillwater's Morning Scramble. Glad to have you in line, and glad to have Scott Petty in. Good to see you.
Hey, good morning. Great
And,
to be here.
and we are safe distancing. You've got your mask there, so
Yes.
everything is going well. We were
Yes.
talking about dealing with the mask, which hopefully everybody is, but we're all learning also, and about if you get a tickle in your throat or a sneeze coming on or everything like that. We're all learning to kind of navigate around that, right?
Yeah, it can be tricky. It can absolutely be tricky sometimes when you have one of those coming on, and there's not a lot you can do about it except maybe grab a tissue if you got one close by, or find your elbow, the inside of your elbow.
We have some sanitizing stuff in here. We have Lysol. We also have tissues over there.
You're
So
set.
we're trying.
You are set.
Well,
And thank you, Steve, for doing that. You go above and beyond. But this is going to become the standard.
Yeah.
I mean, it really will be, and everybody's looking forward to what's going to be happening in the coming days, Friday and Monday, as things kind of start evolving. And
what are your thoughts on that, by the way?
Well,
I mean, I'm not talking about politically necessarily, about what we need to do to do this correctly.
Well, there's so many things that our community is going to kind of gradually evolve into. And we're going to talk with Dr. Crawley in just a little bit, because Monday we'll begin doing elective surgeries, which it doesn't just flip on a dime, because we have to test those patients, and so he can talk a little bit more about that from the clinical side. But I think, like you said, like John said earlier, our elected officials, nobody wants to be back in business and have tax revenue for our communities more than the city leaders. And I think they've been very thoughtful. They've been great in terms of trying to make informed decisions. And so I just want to express our appreciation from Stillwater Medical for their leadership, and we're grateful for their leadership. So I think everybody's ready to get back to some normal. It's just going to take a while.
Yeah. And we have Dr. Crawley on the line now. And good morning, doctor. How are you doing?
I'm doing well. How are you all?
We're doing great. I hope Scott can hear you a little bit here. And I was supposed to pass on a big thank you from John Bartley about the lifesavers. We do use them here. I use them, and he's using them at work. He bought a big old bag, I think, the other day, because he brought some of them in here. But
I think lifesavers may be on my tombstone. That may be my legacy.
Hey, we've got network TV announcers using those. Kerry Sanders with NBC.
We just talked about that yesterday, didn't we, Doc?
Yeah, we were. We were talking about that yesterday, how he came down and tried that. Hopefully, he took it back and spread the wealth.
Well, I know I saw him yesterday. I think he was on a Florida beach or something doing some stories or whatever, and I thought, I wonder if he's using the lifesavers that we taught him to use.
He had his mask on.
Yeah, he did.
Didn't he?
Yeah,
You saw the same thing.
Probably at the beach in Florida, he's not going to have the voice trouble he had here during the flood. What the heck?
Yeah. So, hey, Scott, I'll let you kind of start the direction here, because you mentioned the elective surgeries and stuff.
Yeah. So let me go first. First Friday, we're going to get back into our First Friday segment this Friday at noon. We're doing a Facebook Live this time, because obviously we're still social distancing. You can't have groups of 10 or more, at least for a while, and so we'll be doing our First Friday this Friday at noon from our 12th Street location, but we'll be Facebook Live, and Dr. Chris Goff, and Dr. Don Crawley, who's on the phone with us here, will be with us, as well as John Stewart from Integrity Audio, is it Integrity Hearing? Integrity Audiology. So they'll be answering questions and doing a little presentation this Friday, and so we're kind of trying to get back into a little bit of normalness. But Dr. Crawley and Dr. Goff are with Stillwater Otolaryngology, and great to have them as part of this coming back segment. But this will be the last segment of First Friday. We always run those the first Friday of every month, September through May, and this will be our last segment on May 1st, this Friday. And so, Dr. Crawley, we're looking forward to having you and Dr. Goff and Dr. Stewart.
Yeah, it ought to be good. It'll be informative for all ages. John will mention something about the elder folks with hearing loss and what we can do to help them and stuff. But it'll address hearing loss for all ages, and also associated with that problem called tinnitus, which is ringing in the ears. That goes along with hearing loss and is a big problem, and so we'll address some of that. John is very knowledgeable, and for those that don't know, he's originally from Cushing, and he worked at Tough Ear Institute in Oklahoma City for a while, but decided he wanted to be closer to family, so he came back here to practice in open audiology. And he's very well trained, very knowledgeable, and I tell people he's actually one of the few people who appropriately named his business. He has very high integrity in a business where there are some shady characters.
No, that's great to hear. You mentioned the fact, and Scott has been really good, I think, about on your appearances on here, making sure we're not neglecting our own health needs. Are you finding, or are you concerned that has been the case? Because we're all kind of hunkered down, but we don't need to neglect ourselves, right?
Yeah, we've talked about this some, and it unfortunately it's not only patients but it's physicians. We're kind of in this COVID blinder thing, and when someone comes in, we say, okay, well, you don't have COVID disease, everything's okay, and we forget that people still have heart problems, they still have appendicitis, they still have gallbladder problems. So we're trying to encourage people, if you have problems, please come in. We've made every effort to make the emergency room and the walk-in clinics and our regular clinics as safe as we can be. We screen for temperatures when people come in. Most all the staff is wearing masks and or gloves, and doing everything we can keep minimal people in the waiting rooms and get people from check-in back to an exam room, so they're more isolated with the social distancing as quickly as we can. So, yeah, don't neglect things and sit at home. There have been a couple reported cases where people have just sat home and died from heart attacks because they were too afraid to go to the hospital, and we don't want that at all to happen.
And I will add, we're still taking everyone's temperature at every entrance, every clinic, every entrance of the hospital, and every one of our Stillwater medical clinics to ensure that no one is maybe having a symptom and they don't realize it. If someone does have a fever, they're going to be asked several questions,
sure,
nonetheless. But I know that's going on at every clinic, and we're going to continue that for the foreseeable future.
Yeah, Doctor, how has this changed your typical day? I mean, are you giving tests?
We are not doing. We can do the test at the 12th Street facility. Personally, I'm not doing the test. Most of my patients are not symptomatic,
right,
where they met the criteria. Now, according to yesterday, we're going to open up the criteria again. But most of the patients I've been seeing have not met criteria for testing. If they call in with a problem, say like I think I've got a sinus infection, but I've got a high fever and a cough and stuff, we're recommending that they get tested before they come in, and then go from there. As far as my practice, normally I will see 35, 40 patients a day in a full day, and now I'm seeing about 12. So it's made a big difference there. And it's like today, I don't think I start till later, so I'm sitting out here in my backyard thinking about how I should be in the mountaintop in Bolivia on my mission trip instead of looking over my ever-expanding honeydew list.
Yeah, that's one reason Dr. Crawley's not in our advertisement is he was supposed to be in Bolivia right now on a mission trip, and he's gone. I don't know, how many times have you gone, Doc? Do you know?
Oh, about 18, I think. I haven't quite got to 20.
Yeah,
I can make 20.
He routinely goes on this mission trip, and thank you and the others from our church that do that. And I know there's several churches in our community that have attended that one or go to other mission trips, and that's just a great service. But these are the kinds of things that have been limited, obviously, by this COVID crisis globally.
And when you plan those well ahead of time, my guess is those are on hold too. I saw a thing where they were already talking about the rescheduled Olympics, which would be in Tokyo. They're already meeting and saying, unless we have a vaccine, there probably will be no Olympics next year. And so that just gives you an idea how global we're all in this together, as the saying goes. But it affects the mission trips as well. So,
and what it really enforces and makes things most difficult is there are lots of questions that we don't have answered yet. It was like the medication that came out. We thought that was going to be helpful. It's not. The plasma from patients who've been sick, giving it to other patients, is not. I mean, it's been helpful sporadically, but nothing proven all the time. And I just last night I heard about it, was reading about it this morning about the salivary test to test more people and find out. Hopefully that's going to help. But the problem is there's just so many unknowns, and we don't know how many people have the virus but have no symptoms. and that's the concern. It's almost like a landmine. You just don't know when you're going to step on it, and that's the big concern with re-ramping for elective surgery and opening things. There's just so many unknowns. Are we going to have a resurgence, and unfortunately now we found some people who've been sick, tested positive, tested negative, and come back and test positive again. So it's really hard to predict the future. Certainly months and weeks in advance, but yeah, even a year for the Olympics, everybody's just kind of going, I don't know what to do.
Yeah, you mentioned that, and we've learned more about antibodies, or I mean, you already knew all this, but we're learning about it. But the groups we have in the station now, John's out in the lobby, Scott's in here, I'm in here. We're three middle-aged guys who would probably like to see our parents, but we don't know whether we're really allowed to or not. And I'm not going to. I don't know about Scott. I know you visited and waved.
Yeah, it's been over a month. I went right as this was blowing up because I knew that there could be some travel restrictions, and now there are travel restrictions about going to other states. And so, in fact, you mentioned my parents. They're out in Texas County, which has been a hot spot, and I've called this the rural ripple. We've seen it over in Cushing. And Texas County has 107 as of yesterday. They had 107 positive cases, wow. 75 in Guymon. Guymon's a town of about 11,000. So we've only had 44 positives in Payne County, 22 in Stillwater. Now those are positive that we know of. We've obviously tested some that the doctors say, hey, this is a positive, but it's showing up negative. But they've got the difficulty breathing, they've got all the classic symptoms, and fortunately, they've been directed that you can still count them COVID positive, even though they're negative.
Yeah, Doctor, do you see a time with these antibody tests and with all that's going on where we will be able to find out if we're asymptomatic or not?
I do think there will be. Research is hot and heavy, and I remember a long time ago, I'm not sure who said it, but they said necessity is the mother of invention. And I have no doubt that we have the brains and the technology in this country that we will, due to this necessity, invent something where we're able to test more quickly and screen better and have better vaccines and treatments and get control under this. And ideally, as I kind of always been kind of history major, ideally we look at this as a historical issue that people on down will follow. We learn things from previous endemics and pandemics and epidemics, and so we've made adjustments. And every time you have something like this, you have to make adjustments. But I truly believe we're going to get back to the normal that we knew before with some modifications. The question is that in time for football season? Right. Is it in time for the Olympics? Is it in time for, your grandkids to go to college? I just don't know when that's going to be. But I'm hopeful that within 18 months we're back to a resemblance of normal. And that doesn't, for some people, at my age, 18 months is nothing. But to some people, 18 months is forever. So I just don't know. But I'm confident we're going to get things under control and turned around.
Now, are you concerned about a knee-jerk reaction when we see, Georgia with their announcement that was one of their first ones that opened with Governor Kemp a little more wide open? He's under from some criticism, obviously, but they're kind of somebody we're all watching. Are you concerned that we're going to get too antsy and be too soon?
Well, I am concerned with that. One of the premier tenets of medication, of medicine for physicians, is first do no harm, and we have to continue to weigh that. And obviously, when we do surgery, we do things that are painful, and you have to weigh the risk of the benefit versus the risk of the detriment in medicine. And unfortunately, that spills over now into the economy. You have to measure the benefit of opening up to stimulate the economy versus the risk of not. And I think the key issue is continued vigilance and monitoring. And that's the way we're doing with our elective surgery. As Scott said, we're opening up next week for elective surgery. We're opening up at a slower pace than we would do before. And we're going to monitor this every week and see how it goes, and monitor the community, see if there's a spike in symptomatic patients or patients being hospitalized, and adjust things as we go. And we're not just completely abandoning and going back to what we did before, where And for example, like children that I do tubes on, before that was a 15, 20-minute procedure just because it was gas. And once the child was asleep, we could put tubes in, they wake up and go home. We're having to be a little more cautious. It takes a little bit longer because we're worried about working on the airway with saliva and the kids crying and spitting and screaming and stuff. So we have to protect the staff more. So it's changed those things, how we do it. But I think proceeding to do this is fine. And I think with the advice and or not advice, I guess the mingling of medical recommendations and political, for lack of a better word, government regulations as far as helping the economy, as long as they're working together and continue to have good communication and monitoring, I think that's okay. But, we do have people that say, hey, you know what, I don't believe this, it's a hoax, or, I'm invincible, it's not going to happen to me, and unfortunately we can't change their mind. Nothing I'm going to say is going to change their mind, and that's okay. It's just that we just need to be cautious and watch what we're doing. It's kind of like wearing a seatbelt. You only have to do that if you're having a wreck, but you never know when you're going to have a wreck, so you got to be cautious all the time.
Well said.
Yeah, I think that's I think wearing a face mask is one of those things that for our community, we've been seeing it. I was in the grocery store Saturday night and at the meat counter, and a guy walked up and said, "You must be from Stillwater." And I looked at him, and he didn't have a mask on. And I said, "Yes, I am." "You're not?" And he said, "No." And he said, "It looks like they've got everybody scared to death here." And I thought, I'm not going to engage this. I should have given him some advice about wearing a mask to protect himself or others, but there's still some ignorance, I'll call it, about understanding the benefits of wearing a face mask. And it's going to be the new normal for a while, I believe. And, I saw that several of our local businesses, Chris's University Spirit has a face mask that's a Pete face mask with the mustache, and it's very cool. And I thought that's clever, that's great. So anyway, and we've still continued. I will say this again: those people that are making face masks or have made face masks, thank you. I know the city gave them away yesterday from the police department. They're doing that again today as well, I think from 11 to 2. But we still appreciate those fabric face masks that have been made. So thank you for those of you that have made them, and we'll just continue to say, please continue sending them because we need those face masks. And there's a website out there. You can go to Stillwater Medical Foundation and see the pattern if you're interested in donating those. So thanks to the community for sharing those with our public servants.
Absolutely.
Doc, and I'll add that face masks are uncomfortable. For me, it's not a big deal because I've done this for 30-some years in surgery. If you haven't worn them, they're uncomfortable. It's hard to talk. You can't hear people well, and it feels like it gets wet and mushy or sucked in your mouth when you try to breathe and stuff. And that and the social distancing have been the thing that seem to have helped the most. And like in my case, I wear a mask when I'm out, somewhat for my protection, but more as a kindness or a thought to my fellow Stillwater folks, because I'm around the hospital and my clinic every day. I don't want to be giving it to anybody there. And so it's a two-way street with a mask. It's somewhat for your protection, but it's also to protect your fellow citizens. And it's uncomfortable and irritating and stuff. But sometimes it's just hard to keep a 6-foot distance between you and the other person, and that's what is important. And for example, if they open restaurants, obviously you can't go out and eat with a face mask on. That's not going to work. That's why that's important in restaurants, to be sure you keep that 6 feet distance from other people. Yeah. It just takes effort. It's hard.
Yeah, it's interesting because you're talking about the cool one that they have at Chris's now, and I've seen OSU kind of put on their website some more stuff. Mm-hmm. We had Kelsey Proctor on, who is the director of the Seville Center, and she is a seamstress, it turns. Yeah. And so it's become kind of a hobby for her, and she's made it for everybody at work, all her family. She's making me one.
That's cool.
And so, you kind of make the best of the situation and make it cool, like you mentioned before. Yeah, and cool. So hats off to all the people that are taking their time out to do that. I had an 80, I guess she's 84, and my Aunt Sue made one and sent it to my mom. How cool is that? That's her little sister sent it because, and so then it goes, I guess I ought to wear one because Sue sent one. So it is odd the effect that we can have individuals, right? So,
I want to tell you something else cool.
okay.
Tomorrow at 2:24, the Oklahoma National Guard is going to do a flyover, Stillwater Medical. So step outside Stillwater at 2:24. They're going to be honoring our healthcare heroes and Dr. Crawley, all those that have been serving those and giving back to others. But that's tomorrow, 2:24. They're going to be flying over multiple Oklahoma hospitals. I know this one. I know ours is coming from, I believe it's Tulsa Air National Guard, but they're coming. They're going to go to Bartlesville, then they come to Stillwater, then they go over Drumright. They've got it all timed out, and I'll share those times with you, Steve, so you can
That'd be awesome.
share them again. But yeah, step outside tomorrow, 2:24. It's supposed to be a beautiful day, and thanks to those that are serving our country in other ways and acknowledging the service of those on the front lines here in our country.
Absolutely. And Doc, how cool is it when the people line up and honk their horns and stuff? We see that across the country in different ways. I think that started in New York at a certain time, 7 o'clock at night or whatever.
Mm-hmm.
Everybody would come out, different people, different jobs, different looks, and they all were on the same page. How much does that mean to you to know that the community supports you and really appreciates it?
Well, it means a lot. It's appreciated and it's very important. But I will expand that a little bit. With the focus tends to be doctors and nurses, and we expand that to healthcare workers. But there are at the hospital, there are people, and Scott knows this more than I do. There are people down in the basement who are working every day doing stuff who, quote, aren't on the front line. They're not a doctor, nurse, seeing patients. But I couldn't do what I was doing if they weren't doing what they were doing. This is a truly, it takes a family to raise a village to raise a child. This takes a whole family to keep this going. And the community recognition of that, it makes it worthwhile. I mean, there's nobody who doesn't like a pat on the back and a thank you. And it just makes you feel good. You say, okay, good. At the end of the day, like, geez, am I doing any good? I'm tired of this. I hate this mask. I'm sitting around twiddling my thumbs looking for something to do. And people go, thank you for being here and being available. It just makes you feel a whole lot better and gives you some energy to get up and come back the next day and do it again.
Yeah, I'll tell you, our environmental services folks, I mean, and you talk about the basement, but facilities, pharmacy, materials management, I mean, there's so many people in the basement, nutrition. Every meal that's served comes out of our basement, unless somebody brings a meal, which we've had a lot of those lately too, from the community at different businesses. But I will just say, those environmental services folks, they're there 24 hours a day, much like our doctors and nurses. They're running those Xenex robots. They're disinfecting areas to make sure that they're keeping everyone safe. And so, thank you, Dr. Crawley, for the shout out on those folks.
Absolutely. Yeah. So, anything that we've missed, I mean, we could go on forever, but it is appreciated, all the input you have and the time that you're spending. I know this affects everybody's family as well. So our gratitude is certainly coming your way.
Well, as we close, I'd like to, if listening, I can tell Denise Weber she can relax and her pulse can go down because she's a little worried about me being on the radio because she have a reputation being a bit of a loose cannon. So she can now relax and take a deep breath. I think she survived the morning.
There you go. So,
that's not true.
We need a loose cannon.
She can survive. She can relax. You're right, but that's not true that you're a loose cannon.
Hey, Doc, thanks for all you do, and come by and see us anytime. Anytime.
All righty, yes, sir.
Thank you.
Thank you all.
See you, Doc.
There you go. There's Doc Crawley, and I really appreciate you lining him up.
Yeah, absolutely. He didn't mention it, but he's in the Incident Command Center with us every day with about 10 or 12 other individuals that are in and out throughout the day giving reports, and they're collecting data from the state, they're collecting data from the national associations, the hospital association, and others. And so it's great to have those various minds and expertise. And he's a doc that's been practicing for 30 plus years here, and has a significant amount of wisdom for sure.
I'm going to get a legal ID here and make sure that we're legal.
Yeah,
I want to make sure that because it's been a long segment, we'll do that here.
KOSV, Perry Stillwater. KOKP, Perry Stillwater. KOKP, Blackwell, Ponca City. It's Triple Play Sports Radio, your home for live and local sports talk.
And by the way, if that may be John Bartley, if he's calling in at, I was going to tell him he could, 533-1051. Is that John?
No, this is Ray Chambers.
Ray Chambers.
Central Electric.
Oh, okay. So you're going to be on here in about 15 or 20 minutes. You're going to be on closer to the bottom of. But I'm glad you called, and you're going to be our guest, and we're going to talk about all the stuff you're going through right now, right?
Sure.
Okay. All right, Ray. I appreciate it. I'm going to leave you on hold there, and then we'll talk during the break. But Scott, I wanted to know if and so if John wants to call at 533-1020, that's the other line. 533-1020, we can do that if he wants to. But I want to make sure that we get your stuff out there, Scott.
Yeah, I think we covered everything. Certainly there's an enormous burden on our professionals. And so we've talked about resilience and post-traumatic stress disorders that can be, a serious concern for our community and for those that are serving. And terrific to have Joni O'Neill on. She talked a little bit about how to decompress stress, and I think we're going to try to have her, as we talked about, a monthly segment for Wellness Wednesday, because she does such a great job, and she's so knowledgeable and shares very specific tips and tricks to enhance your well-being, your mental well-being. And so thanks to Joni for being willing to do that, and for Total Health.
And we do have stresses throughout life anyway.
Oh, yeah.
I mean, and so these things are relevant all year round, every year.
Right.
But especially right now, I think people are thinking about it more. They're missing their families.
Yeah.
They're missing their work.
Yeah.
And it's easy to have a good attitude when you still have your job and your family intact. But some people don't have that necessarily right now. So the added stress that those folks have, it's impossible for maybe us to put ourselves in their shoes. But it's important we try, I think.
Right, and there's a lot of self-help out there, but it's also nice to be able to, turn on your station and be able to hear somebody like Joni that has expertise in this field and can impart her wisdom and share some thoughts about how to contain that and how to improve upon yourself, especially when you're spending a lot more time with your family, possibly if you're working from home. That in and of itself, not interacting with people you normally interact with at work, there's a little bit of anxiety that goes along with that.
And
for
for our people in the nonprofit world, our United Way agencies and stuff like that, some of them their need has been ramped up. Domestic violence is up, obviously, across the country, and I think they anticipated that. People are at home, they're on top of one another. It may not have been a perfect home to start with, and now you add this burden. And so they're having to deal with extra stuff now.
Yeah. And you mentioned Kelsey earlier. I served on the Seville Center Board. I know John has too, and they serve a great service for our community. And I know that they've been pushed to the max here recently with some of that goes on. But you're right. I mean, those types of things, those types of crises don't stop for a pandemic. Sometimes they're even magnified, and so. Shout out to our Stillwater PD and those that have to interact too regularly with abuse victims.
Absolutely. Well, thanks for all you do. And
thank you.
And anytime you need something, you've got my number.
Yeah.
So, and I vented to him over the weekend. Appreciate you being there for him.
I was glad I missed that segment that you were talking about.
Yeah.
But that's kind of life. Sometimes people get twisted into a different vortex, and their opinions kind of get jaded.
You need friends you can count
Absolutely.
on. And so I reached out.
Absolutely.
So, hey, thanks for all you do, though.
You
appreciate
bet.
it.
Thank you, Steve.
There you go. There's Scott Petty with the Foundation and Stillwater Medical Center. Our show brought to you by Stillwater Medical Center and by our great friends at Simmons Bank.